March is Colon Cancer Awareness Month, and today we're diving into symptoms, prevention, and more. Doctors Gautam Mankani and Val Simianu join us now from Virginia Mason Franciscan Health. Welcome to the show, doctors.
Thanks for having us.
I know you guys are busy, so we'll get right into it. You have the top 3 things to know about colon cancer. Let's start with number 1. Colorectal cancer is on the rise in people under 50 years of age. Please explain.
Yeah, so when you think about cancer, you think of it as being a disease of older people, which is true. In colon cancer, we're also starting to see it in young people. In fact, half of colon cancers occur in those younger than 65. 65 is the new 50, right? And we're seeing it in 40-year-olds, we're seeing it in 45-year-olds, so it's something we are worried about as a society.
Yeah, and that, like you said, it's not always top of mind because we think this is going to be something that might happen later in life.
Totally.
Dr. Simianu, I want to get to you to factor number 2. Colorectal cancer is the 3rd most commonly diagnosed cancer and the 3rd leading cause of cancer death in the United States. Tell us more.
Yeah, that's true. And I think, like Dr. Mankani said, it's on the rise in young people, and we think it's going to be the number 1 cancer in those under 50. The good news, on the other hand, is that cancer can be prevented by colonoscopy, sometimes treated completely by colonoscopy. And when we catch a cancer early, we can cure it 90% of the time.
Gosh, so what advice do you have for people then to come in and get screenings then right away at a certain age?
Yeah, if you have any questions, you can always ask your doctor. I'm glad you brought it up because we are actually hosting a live webinar next week. There's a QR code available for those who want to register to learn more about this. But if you want to know what options are available to you, best thing to do is ask your doctor, whether it's a colonoscopy or stool test or something else.
Definitely, and we have that QR code up. Dr. Mankani, getting to the 3rd fact. These are all very interesting because unless it's in front of you and you're telling us these things, it's not always top of mind on what to do. There are early symptoms to be aware of, and you can prevent colorectal cancer. What are the symptoms that you're talking about?
Yeah, great question. You know, building on what Dr. Simianu said, it's back in the day when a young person came in with blood in their stool, so one of their symptoms, we said, you know what, that sounds like a hemorrhoid, you'll be fine. We all have hemorrhoids. But it's one of the symptoms of colon cancer. So blood in your stool, abdominal pain, weight loss that you shouldn't be losing, or your GI tract just isn't right. Now these could be many other things as well, but with colon cancer on the rise, it's something worth going to your doctor about.
Yeah, and how can it be prevented?
Yeah, so the nice thing about colon cancer is it's a very preventable disease. So we have lots of tests out there. So the time it takes for cancer to form is about 10 to 15 years. And you can screen for it with colonoscopies. We have stool tests. We have other new cancer screening tests coming out. There's a lot that can do. So basically pay attention to your symptoms or do the screening tests, and best both.
Definitely, and I feel like we should end there on just how people can learn more about the symptoms, the screenings, the risk factors, to not just kind of say, oh, it's probably this and don't worry about it. Obviously talk to your primary doctor, but what else?
That's it. You know, join our webinar. It's free. We'll be talking about the symptoms you have, but don't ignore your symptoms, and any one of your healthcare providers can help guide you on what's appropriate for you.
And this month is obviously important to get awareness around that. So speak to how important it is to get this in front of viewers.
Yeah, no, we really appreciate having the chance to be on the show and talk about it. I mean, I think it is something that people don't often talk about. You don't sit at dinner and talk about colonoscopies. But this
but you
isn't,
should.
But maybe you should, and maybe you'll talk about it because you watch the show.
Awesome.
Yeah.
Thank you so much for your time. We really appreciate it.
Thank you.
New Day Northwest is sponsored by Virginia Mason Franciscan Health.